Here is your question. Right. So if you have read and understood, considering the communication skills station, kindly please begin.
Yes. Hello. I'm Dr. Faizan. I'm one of the surgical doctors. I was told to speak to you about the condition of your child. So, can you please tell me what you know about his condition so far? Her
Please
condition.
confirm the identity, if who she is of the patient. And
Can you please confirm your name and age, please?
not a, if you are the mother of Miss X or whatever.
Okay. Okay.
You
Okay.
have to confirm the identity. Yes.
Okay.
Yes.
Yes. I feel guilt that I felt my son, my daughter. I was in the work. I'm worried about her. What happened? What happened, doctor? Some of his neighbors told me that she came in the hospital after something like a tummy pain or something like that. I need to ensure that she is fine.
Yes. I will tell you everything about your doctor. Please have a seat. Uh, the daughter was brought to our hospital by her teacher with complaints of tummy pain, uh, and our investigations and examination has shown that she might be having something called as acute appendicitis, which is a serious condition. Currently, she is being resuscitated with medications, antibiotics, and we're giving her IV fluids and antibiotics. And probably she will be operated upon by our consultant for removal of the appendix.
Removal the appendix? How would you remove this? Did she need a surgery?
Yes, most likely she will be needing a surgery. Our consultant is on the way, and he will be operating upon her.
Oh, you mean that she is now in the surgery, right?
No, she is not. She is currently being resuscitated, where we are giving her medications, IV antibiotics and painkillers to relieve her pain. And after resuscitation, we will be shifting her to the operation theater. I'm so sorry you did not get to see your daughter, but the condition of your daughter was such that we have to take her emergently to the operation theater.
And are you sure this is what is you told appendicitis? She has this small tummy pain days ago or week ago, and she will become fine. Are you sure this is
No,
appendicitis?
no, Mrs. X. As from our examination and the lab investigations, the signs and symptoms which we have seen, it is most likely suggestive of appendicitis, but we cannot be 100% sure until we open the abdomen and see.
So it's very dangerous. It is a life-threatening, doctor.
In children, as there is a less fat in the abdomen, it can be dangerous. but you can be assured that your daughter is in experienced hands, and we will try our best to do best for your child. If there is any perforation of the appendix, then the patient might go into peritonitis, which is a serious condition, and we might have to refer your daughter to a higher center if it happens.
And what are the complications of surgery? I think it's the major one. It might have many complications, right?
Yeah, complications of the surgery can be if there is rupture of the appendix when before we open, then there can be complications which there can be severe spread of infection, and there can be spread of infection, and patient might go into sepsis, which is a serious condition. And also, if there is a spread of infection in the abdomen, then there might be a damage to the reproductive tubes of your child, and which might affect the fertility in the subsequent years.
So you say that the operation has may go to what's called sepsis. I don't know this what is that, and so we can not to do the surgery. We can refuse the surgery if it is dangerous, and just take some drugs.
Mrs. X, the surgery is essential in the case of your daughter, as if we don't operate on her, then it might worsen. So we will be most likely be operating, and we will be removing the inflamed appendix, which will most likely lead to the resolution of which will improve your child. And if we don't operate, then it can worsen and it can lead to peritonitis. Sepsis, there are more chances if it ruptures, and if you don't operate, the appendix might rupture, and it can lead to something widespread infection, which we call as sepsis.
So if she go to the surgery, the appendix will rupture, and if he didn't do the surgery, the appendix will rupture. I am confused. What about the wound, doctor? This is the wound is disfiguring, sorry.
Sorry, I didn't get you.
If the wound is the wound, she is a small dot, a small girl.
Disfiguring, yes.
Yes,
Yeah,
yes.
we will be using a small incision over her tummy, which will leave a small scar. But if the need arises, we might have to extend the incision, or we might have to perform a laparotomy. In that case, that will leave a bigger scar.
Okay, what about her future to be pregnant? I think this appendix is near to her organs. What about her fertility in future?
If the infection has spread, if there is a peritonitis, then there is a chance that reproductive tubes might be involved, and it might lead to affect her fertility. That we will have to open up and see. I cannot say for sure that it will happen. We will have to open up and see the condition.
And who will did the surgery for my daughter?
Your surgery will be done by Mr. Mann, who is our consultant, and Mr. Ladd, who is our consultant, and he's an experienced surgeon, and he's on the way.
I need to see my daughter. Can I see her now?
I'm so sorry that you won't be able to see your daughter now, because she's being shifted, and she's in a restricted area, and you won't be having access to that area as of now. You can see her after.
Why she is in a restrictive area? I need to see her. It's my daughter.
She is being shifted to the operation theater, and I don't think you will be allowed into the operation theater, Mrs. X.
But the consultant is not here till now. What she doing there in the theater? I need to, please let me to see her.
Okay, good. Thank you. What more you could have added? In real scenario, mother will be One, mother will be feeling guilty and crying a lot that it's her fault that child has this pain. Secondly, when she'll hear that Mr. Lord is the surgeon who will be operating the child, she will refuse surgery. She will say that he is the surgeon who killed my husband, so she does not want him to operate on the child. So this is something more you could have practiced on. In the real scenario, if you meet the mother, you'll face one hysterical mother. She will be crying a lot and making her own self guilty of all this. So when you ask her to sit down, maybe you, at the same time, she'll be crying and sobbing all the time. Maybe you can, when you ask her to sit down, you can maybe ask her to offer a glass of water to calm her down, or maybe you can ask her if she needs someone, any friend or close relative to be with her, so that she won't feel taken away, taken back that she is right now. Or maybe you can offer her a tissue paper because she'll be crying and sobbing in a lot of hysterical situation. Secondly, in your whole conversation, you have used multiple times your professional dialogues and terminology. All this explanation was supposed to be carried out in very layman language. So you'll hear the recording of peritonitis and abdomen and laparotomy and exploration and all those words we have to avoid, right?
Yes.
Yes, good. And when you explained that it could be appendicitis, it would be better if you can have a piece of paper and a pen, and you can draw and explain to the mother at the same time. Look, this is the abdomen. This is the, instead of, I'm sorry, I'm saying abdomen to you, but this is the tummy. And there could be this structure here, which gets inflamed or so infection or inflamed or layman terminology, which is easily understood by even uneducated English speakers instead of using our professional terminology. So piece of paper and a pen and draw it in front of the patient's mother so that she can understand what exactly you're talking about. And when you talked about that normally in children, there is less fat in the tummy, then you can say in adults, normally there is this organ, there is this structure, we call it omentum. It's called the policeman of the tummy. But in case of children, this is not well developed and children have less fat. So you can elaborate a little bit. You can explain in layman language, as layman language as you could go. So they don't have the momentum, they have less fat, so there are more chances that this structure, when it gets inflamed or infected, there are chances that it ruptures. That's when it becomes lethal or fatal or life-taking. So when you're explaining it like this, little bit more elaborately, it will help mother to understand. Good. Thank you.
I don't think I was very good, ma'am. Actually, I don't have much practice.
This is the first time you practiced, so